welcome. Now we've got some health for you here, and today on Health we are joined by Dr. Ifedayo Ezenwa Adejare. Now he's a consultant urologist with over 20 years of experience in medical practice, 8 of which have been as a urologist. Now he joins us to talk about men's health and urology, the branch of medicine and physiology concerned with the function and also disorders of the urinary system. You are welcome, Doctor. Good to have you here.
Right, nice to be here as well.
You look exactly like a doctor. No gainsaying there.
Yeah.
Now, when we told people that we're having a urologist come over, they sent in some questions, and very interesting questions, some of which I didn't think about myself. But first off, let's intimate people with who exactly a urologist is, apart from the fact that it's a word that you can't pronounce after every Friday night when you're out with your friends. It's
sure you can't pronounce it after every Friday night. Anyway, so a urologist essentially is the doctor, a surgical specialist that deals with problems in the male genital tract and both male and female urinary system.
Okay.
Essentially, that's what a urologist is.
Okay, but you're focused on men's health.
Yeah, but we're just talking men's health.
Yeah, okay, fantastic. Why should men care about urology?
Yeah, I mean, it's a very important aspect of a man's life. You know, sexual health, the urinary tract. Especially when men are getting older, some of these things begin to malfunction, ever more so. So it's very important. I mean, you see a lot of men with prostate issues, urinary problems. Unfortunately, quite a number also with prostate cancer, some with stones in the urinary tract, and sexual problems, erectile dysfunction, and the like. And these things cause a lot of issues maritally, socially. The men have, I mean, the man who's incontinent is unable to hold his urine. Yeah. Yeah, it's very embarrassing.
Wow.
Yeah.
Is there a correlation between these problems and habit, especially in earlier life?
Probably not. Most times, if there are habits, there are probably habits that have to do with things like smoking.
Oh, really?
Yeah. I mean, if you smoke heavily, you're putting yourself at risk of things like erectile dysfunction later on in life, because that affects the vessels in your body, your blood vessels, which is one of the risk factors for.
Wow. Yeah. That's an information people need to hear, because not every smoker out there knows that. That's very interesting. I've got a question here from people who sent these in. First off, they wanted to know about the term urology and also reproduction. They show up always in the same phrase.
Sure.
So that correlation, can you explain that to us?
Yeah, so I mean, a lot of the work a urologist does has to do with reproductive health in men, sexual and reproductive health in men. I mean, we tend to see a lot of men with fertility issues, low sperm counts, who need help in evaluation and treatment of that problem. You also tend to see a lot of men with erectile dysfunction, premature ejaculation, and other sexual issues who, you got to find out why they have these problems, help them treat it. As you know, these are real other room issues, the other room issues.
Other room, not the kitchen.
Yes,
not the kitchen.
The other room issues that lead to serious breakdown in communication between couples.
So. Oh, wow. It is important that men and women, of course, should get screenings often. When should they consider starting getting these screenings? And what are the ones available at Evercare, for instance?
Yeah, so specifically now in urology, I think for men, the most important screening is to check for prostate cancer. We are Africans. There is a 1 in 4 risk of a man developing prostate cancer amongst blacks.
What is prostate cancer exactly now? We hear it all the time, but I think the specific definition eludes us.
So, I mean, it's straightforward. That's a cancer growing in a small organ in the urinary tract just below the bladder. It's very deep in the body. So, I mean, except somebody that examined you before, you would never know there's an organ called the prostate.
What's the function of the prostate?
It's just there to support reproduction. I mean, it produces fluid that's about 30% of what comes out as part of semen. You can remove it completely without affecting fertility potential, though that person is unable to naturally father a child. would need help with, treatment of all kinds.
It being responsible for the fluid that actually helps disseminate semen. Wow.
I was going to talk about screening. Let me know.
Yo, please. We digress.
Yeah, we digressed a bit. So, I mean, specifically, screening for prostate cancer is very important for men who are up to 50 and above. Yearly basis, you should get a PSA test, which is the blood test, which measures a protein produced by the prostate. And this blood test, we use it to assess the risk of finding prostate cancer in the particular individual. The other thing that you should do is to get a prostate examination, because you could find some men with normal PSA, for instance, who have abnormalities on their prostate that are suspicious for cancer. So those two on a yearly basis help to identify men at risk of prostate cancer. Then, depending on the findings of those tests, you go ahead and do further testing, something called a biopsy, where you essentially take a sample of the prostate to see what's in it, and therefore, you can make a diagnosis. The key in prostate cancer care is early diagnosis.
Okay.
Early diagnosis and the right treatment leads to good outcomes.
Okay. So you say it's important to start these screenings from when you're 50. Any younger? What if?
Yeah, I mean, for younger men, for those especially who have high risk, if there's a positive family history, or one or two or more first degree. Yeah, there's some genetic component to it. If there's a positive family history in 2 or more first degree relatives, a brother, uncle, father, those kind of men should actually screen early. I'll tell you, I've seen a couple, unfortunately, of men who develop prostate cancer, and I have seen one in his 30s and one in his 40s. And when I asked the gentleman who was in his 40s, he said, his dad died at a very young age. I suspect that man probably had prostate cancer.
Wow.
Unfortunately, he also
passed. That's unfortunate. How regular after your first screening should you then take this?
For anybody, it's about 50 on a yearly basis.
On a yearly basis. Are they expensive, these screenings?
No, they're not. They're well within affordable rate. Yeah.
Okay. Now, so how can viewers actually take advantage now, seeing that they've heard this information and knowing how important it is, especially if you're male? How can they take advantage? What do they need to do? Where do they need to go to get these screenings?
So, I mean, I would advise every man to go see his doctor on a yearly basis, get a blood test, the PSA test, and a prostate examination. And if there's any concern, request a referral to a urologist to get that evaluated.
At Evercare, do you have to pay for these first consultation?
Yes, yes, you do have to pay for.
But it's inexpensive, like you said.
No, it's well within an affordable range.
So, what are you doing, doctors generally, now to make people more aware of this? Because this is something that not many people think about.
I think there's too little advocacy about men's health issues. There's a lot of talk about breast. Pardon me, but I think it's very necessary.
It should balance.
Yeah, there's a lot of talk about breast cancer, which is very necessary, but very little talk about prostate cancer, for instance, just to give an example. And I mean, this is one of those things that we need to do to, improve the awareness. Of course, I think there's a need for more advocacy groups for men's health, and I think there's a need also for men to talk about issues that affect them health-wise. There's this reticence about men who just want to keep quiet. They don't want anybody to know what's going on with them.
Culture.
Culture. I'll give you a quick example.
Real quick.
I have a patient in the hospital right now, last week. He was on admission for surgery, had surgery, my patient. His brother was in the next room for another reason. And neither of them wanted to know.
Wow, they didn't want each other to know that they were...
each other to know that they were in hospital.
Wow.
And they were in the same hospital.
Wow.
On the same floor.
Wow.
And a third brother was looking after
both of them, not letting you. It's a very crazy drama regarding health. But if you're out there, you've heard from the good doctor himself, Dr. Ezenwa here. He's telling you guys, get yourself checked, especially on a yearly basis, especially past the age of 50 or even before, because there are men who actually have these problems from before then, and make it a yearly check. Thank you very much, doctor, for coming through and letting us know about all of these. I mean, it's very, very important information, and we are fantastically glad, if there is such a phrase I could use, that you actually made this a platform to tell people about it.
Yeah, my pleasure being here.
And you too. All right, just hang on a second. Do stay tuned. Don't go anywhere, because we've got plenty coming your way. we've still got more than an hour on the show here today. Even if it seems like it's been a year since we've been on it, it's because of Mary, and we still have a discussion to go. We'll tell you about that one after.